Now I would like to give the floor to Alfonso Tolmos. He is the Vice Minister of Social Policies and Evaluation from the Ministry of Development and Social Inclusion, the MIDIS. And I'm sure we can apologize if he has to step out during this opening ceremony because he has a previous engagement at the Congress of the Republic. So, thank you very much. Dr. Alfonso, you have the floor. Good morning, Dr. Fernando Leanes. Thank you very much for inviting me today. Vice Minister del Carmen, Mr. Pedro Pablo Villanueva, Andres de Francisco, distinguished friends, good morning. For us, this particular session is very important. Besides any last-minute thing that might arise during the day, it was important to attend this opening ceremony to express the priority that this kind of issues has in the country and the priority they have from the viewpoint of the healthcare sector as the key leader in this review, but also the priority it has at the level of the executive branch and at the level of the government at large. From the viewpoint of the development and social inclusion policy that, as you know, is led by the MIDIS, and this is a new way of doing politics in Peru. I'm referring to public policies. The MIDIS is not a traditional sector, as you may know, but it is a sector that, in addition to providing social services with their 5 social programs, it also plays an articulating role, a coordinating role, an entity that generates benefits so other stakeholders, other key players at the different levels of government can also take a look or can reinforce their action in the most vulnerable populations, those populations living in a situation of poverty in the country. In that regard, in the last 2.5 years, we have created a system, a new system, a national system of development and social inclusion. And this system has some sort of board of directors, which is called the CIAS, which is this Council of Social Ministers, CIAS, by its acronyms in Spanish. And we, as MIDIS, act as a technical secretariat. This Council of Social Ministers is a very important space or opportunity to discuss the social policy of the country, which goes beyond the role of each of the ministries on an individual basis. But in a joint and articulated manner, we have a meeting of 12 ministers, including, it is almost like the cabinet, but it is led by the Prime Minister. The social policy is led by the Prime Minister. It's worth underscoring that. And in that sense, our Prime Minister is extremely involved on these aspects. And we also include other ministers, such as the Minister of Finance, Minister of Health, Minister of Education, Ministry of Development and Social Inclusion, Minister of Infrastructure, which provide services, but the idea is to take the same view regarding social policy and social expenditure, because the purpose of the CIAS is social policy and social expenditure, so we can have an overall view. We are trying to push this forward. We have had a meeting a month ago, and this is a space that not only seeks to bring together the different sectors, but also they would like to bring together the different levels of government and the civil society. A clear example of this is that in this past meeting, Bajo attended this meeting. Bajo attended the CIAS as part of one of the agenda items, and they shared with the different ministers a keynote speech from Professor Marmot, who visited us a month ago. He shared this social policy perspective for health. This goes beyond the Minister of Health, of course, but this has an intersectorial perspective or approach. This is what we are seeking. Within this CIAS, in addition to discussing health issues, we addressed other multisectorial aspects that have to do with the discussion we are having today. One of the critical items of the agenda was early child development, which is a relatively new concept. But we as Peruvian citizens want to take important steps in this area, and we want to take the leadership on this area because we all agree that this is a priority for the country because of its impact it has not only in the current population of boys and girls and pregnant women and also women in childbearing age, but also we need to consider what kind of country we want in the following years, a country with lower ratios of criminality, a country with better health, better education, a more productive country, a more competitive country in the long run. We could list several benefits that give the country today and tomorrow a priority in the specific policy of early child development. This entails, of course, taking a look at the different components of the health sector, but also we need to address issues related with development and learning, not only of children, but also of parents. How can we become better parents to raise better children, especially those who have just been born? This also has to do with a housing policy and a water policy and a water and sanitation policy for this matter, because one goes hand in hand with the other. If we ensure that water is provided in a safe manner to the population, because it is not enough to pipe the water and it will reach the population in poor conditions, but water needs to be safe. It shouldn't harm the health of children. So in that case, we are taking important steps in early child development. All these aspects and many others, such as identity, issues that have to do with teen pregnancy, we still have a stagnant rate of 13% in teen pregnancy, but there is a proactive attitude of the government, and there is a work team that has become formalized and that is working on teen pregnancy or adolescent pregnancy in order to submit a specific proposal and highlight aspects on how to solve a problem that ends up affecting also, for instance, the ratios of chronic child malnutrition, the ratios of a number of indicators that we want to address in today's discussion. So I wanted to highlight the role of CS. It is an open space, although it's a coordinating executive space for the ministers themselves to discuss the social policy. It is also a space of participation of the civil society, as we have seen with PAHO support last month, and also the support of regional local governments. And the content of the discussions, or at least articulating framework, is the a national strategy of development and social inclusion. This is not a strategy from the MIDIS or the social programs of the MIDIS, because the MIDIS goes beyond the social programs, but this is a strategy that follows the entire life cycle. It has a life cycle approach where it treats each age group of the population according to the results and outcomes and needs of each age group. So we have components that go between 0 to 3 years with their own specific results, focus on nutrition. Then we have early child development until 5 years of age, the comprehensive development of childhood and adolescence, which is between 6 and 16 years of age. This is the age where children should be attending school. I am saying they should because they do not always attend school. But in that case, for instance, we have an initiative jointly with the Ministry of Health and Ministry of Education, which is called Aprende Saludable, Learn in a Healthy Way. You have seen that how in the beginning of the school year there was a mobilization initiative of the 3 key ministries, giving emphasis to this articulation, this coordinated work, because we are no longer in those times where we used to work individually. Now we have to work as a team in an articulated and coordinated manner, and that is why we are working strongly at the executive level. We have another component that has to do with economic inclusion. This has to do with productive projects, basic infrastructure that needs to be provided to those who need it the most. And many times this is not just a matter of money. When we generate and design, when we designed FONIA, which is a fund of incentives for infrastructure, one of the remarks was that how come this is possible? The sectors already have money. It is not an issue of lack of money or limited resources, but the incentives to reach the most remote district were not laid there. So the money was not allocated in that area. So what this fund does is first to allocate incentives to the most remote areas, the areas where they do not even have water, or they do not even have roads, or electricity, or telecommunications. Those remote areas, sometimes they have not even conceived technologies to reach those remote districts. So, as part of this discussion, as part of this strategy of Incluir para Crecer, Inclusion for Growth, we have had a number of initiatives such as early child development. We have 10 sectors working coordinately. Many of you are aware of that type of work, so we can agree on each word, on each term, on each outcome, on each result. How are we taking care of this population, this initiative of Aprende Saludable, or learning in a healthy manner? So these funds are not to be executed by MIDIS. These are funds that encourage others to reach the most vulnerable and poor areas of the country. And I would like to highlight this latter fund that was launched in Huancavelica a few weeks ago. This is the fund for providing incentives for performance and results. It's called FET. This is an interesting fund because it takes the good experience of what was done before as a government, not only thinking about the government, but also as a Peruvian state with the experience of European. This is a fund that seeks to encourage regional governments, so as they meet the management goals that they set with the MIDIS and Ministry of Finance, and as they meet the goals for service coverage, everything related to early child development. So the fund gives something like an additional incentive. I don't know whether to call it a reward, but it's like an additional incentive so they can continue working in this way. They can continue providing this. So this experience takes lessons learned from this Europan, which is an experience that already ended, allows us to improve some additional aspects, such as addressing the child, but in a more or looking at the child in a more comprehensive manner, not in a compartmentalized manner. But these incentives are provided that these intersectorial packages are given to them. So it is not enough for one other sector to provide their services for their relevant sectors, but this incentive will be provided as long as the 4 sectors involved in one single package delivers this, and the regional government needs to make sure that this is received by the final recipients. This is just to share with you some of the actions that are being taken, but also to underscore that, as Fernando said, there are still some challenges. Yes, there are still some challenges. We cannot cover the sun with one finger, but we want to underline that the commitment of the government in continue tackling this government and taking immediate action is there. And many of you who know how we have been working on this are aware of this. And I know we have our strengths, our weaknesses, but there's a serious commitment on continuing working this way, and there's a conviction that we will continue improving in the different indicators that we have been improving, but we will continue doing so. There's a strong commitment. There's a spirit of teamwork. As we discussed previously with Viceminister del Carmen, at the executive level, this is what we have, and this is critical because we are confident that this will yield very good results. And this is not a work done only by the national government, because this is a shared responsibility. This is not, I mean, it is a responsibility of the government, of course, but each one needs to take its part. The political parties, they also need to take on their own responsibility. Each of the stakeholders or the players of the civil society, the families also, we all have to be accountable for this. We all need to take our own bull by the horns and to continue pushing this cart, and it's worth doing it if we want to have a better society. Thank you.
Thank you very much, Alfonso.